Hello everyone. Today we're going to talk about a disease that has become popular in recent years. Today we are talking about lymphoma. Have you ever heard about it before? Lymphoma is a cancer of the lymphatic system. Before we start diving into the condition itself, we need to know more about the lymphatic system. Our role today is to answer most of your questions regarding lymphoma. Today we have Dr. Eom, who is a leading doctor at Catholic University Korea Seoul St. Mary's Hospital. He's going to discuss with us everything about lymphoma from an experienced medical point of view. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Eom.
Hi,
nice
good morning.
To meet you.
Yeah.
Can you please present yourself?
I'm Dr. Eom. I'm from Seoul St. Mary's Hospital. I'm specialized in treatment of lymphoid malignancies, including malignant lymphoma and chronic lymphocytic leukemia.
We'll start talking about lymphoma first.
Yeah.
Doctor, what is lymphoma?
Lymphoma is a cancer of the lymphatic system, which is a part of our body's germ-fighting network. Lymphoma is broadly divided into Hodgkin's and non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma is then divided into around 50 or more subtypes and are simply separated by aggressive and indolent lymphoma, depending on their biologic behavior.
So what is exactly Hodgkin lymphoma?
Hodgkin's lymphoma is a type of lymphoma which was described by and then named after British physician Thomas Hodgkin in the 19th century. This kind of lymphoma has a pathologic hallmark resembling owl's eye and the so-called Reed-Sternberg cells. Generally, Hodgkin's lymphoma has a favorable prognosis. Lymphomas other than non-Hodgkin's lymphoma are, that is, the lymphomas without Reed-Sternberg cells are collectively called non-Hodgkin's lymphoma.
So what's the difference between aggressive and indolent lymphoma?
Yeah. Aggressive lymphomas, and also known as high-grade lymphoma, are defined as a group of fast-growing lymphomas. Since these tumors tend to progress and spread quickly, immediate intervention is required after the diagnosis. Otherwise, the patient could survive only several months or a year or less at most. On the other hand, indolent lymphomas are a type of lymphoma that grows and spreads slowly, and the clinical course is very slow, spanning several years, even without any treatment.
Talk to us more about the extranodal lymphoma.
Yeah. Extranodal lymphomas refers to lymphomatous involvement of anatomic sites other than the lymph nodes. Almost any tissues or organs can be affected by lymphoma, with the most common extranodal sites of involvement being stomach, central nervous system, lung, bones, and skin.
So what is the etiology of lymphoma?
It's unclear what causes lymphoma, but a few risk factors are known to be associated with these cancers. These risk factors include immunodeficiency, autoimmune disease, age, some time of viral infections such as Epstein-Barr virus infection, and chemical and radiation exposure.
Can you now tell us more about the symptoms of lymphoma?
Lymphoma may not always cause symptoms, especially in its early stage. Sometimes it might not cause any symptoms until it grows quite large. Some people may notice a swelling of the lymph nodes. Since there are lymph nodes all around the body, the swelling can occur everywhere in our body, but usually in the neck, groin, abdomen, and armpits. The swellings are often painless. Other symptoms may include ongoing fever without any evidence of infection, night sweat, fever and chills, weight loss, and reduced appetite, and persistent fatigue or lack of energy, especially in advanced cases.
So, doctor, what are the main methods to diagnose lymphoma?
The ultimate method for diagnosis lymphoma is a pathologic examination where a sample of tissue may be taken and the presence of cancer cells cells is confirmed under the microscope by a pathologist. Other methods such as computed tomography and positron emission tomography are auxiliary in diagnosing lymphoma. Such methods are useful in determining the stage of the disease rather than a definite diagnosis.
What are the different stages that lymphoma has, and how each stage is characterized?
The stage of lymphoma describes the extent of spread of the tumor using the Roman numerals 1 through 4. Stage 1 is defined if the cancer is found in one lymph node region, and the stage 2 is if the cancer is in 2 or more lymph node regions on the same side of diaphragm. Stage 3 and 4 are more spread disease. If the disease involves lymph node areas on both sides of diaphragm, the disease is defined as stage 3. Stage 4 disease differs if the cancer spread throughout the body beyond the lymph node. In this instance, the disease most often spread to the liver, bone marrow, or lungs.
So are there any therapeutic techniques for lymphomas?
The principal modality for treating lymphoma is chemotherapy, usually given in combination. Radiation and surgery are auxiliary methods for lymphoma treatment. Radiation therapy can be given with a curative intent, especially in early stage of a certain type of lymphomas. High-dose chemotherapy followed by autologous stem cell transplantation is used for relapsed or aggressive lymphomas with high-risk features for relapse.
Also, doctor, what is the prognosis for patients with lymphoma?
The prognosis of lymphoma is highly variable depending on the subtype of the disease. According to a recent report, around 80% of the patients with non-Hodgkin's lymphoma survive their cancer for 1 year or more after the diagnosis. 65% and 55% of the patients survive for 5 and 10 years or more, respectively, after they are diagnosed.
So can you tell us one last question about lymphoma? So what is the clinical practice guidelines, and how can people prevent it?
Unfortunately, many of the risk factors for non-Hodgkin's lymphoma are outside a person's direct control. The following factors, however, can be controlled. These include avoiding behaviors that increase the chance of getting AIDS and hepatitis C infections, since both weaken the immune system. Avoiding unnecessary exposure to radiation, maintaining a normal weight, and eating a healthy food are important. Rarely, some women develop lymphoma in the scar tissue around breast implants. Therefore, the decision to get breast implants should be well throughout.
Today, we learned many things about lymphoma in detail, such as its symptoms and treatment. Thank you for joining us once again at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.